Hello friends, welcome to Creative Medicine. In this lecture, we will learn about
in water hammer pulse or collapsing pulse or Corrigans pulse. Here first you will ask the patient to raise the arm, and then you will feel for the pulse, and you will bring the arm downwards. When you bring the arm downwards, then you will feel that the pulse is bounding, and this bounding pulse which is seen is called as water hammer pulse. It is something when you hit something when you hit an object with water hammer, the pressure that it comes, in similar way the blood also comes with that pressure, producing the pulse. This is water hammer pulse or Corrigan's pulse or collapsing pulse. This water hammer pulse or Corrigan's pulse or collapsing pulse is seen in aortic regurgitation, patent ductus arteriosus, arteriovenous fistula. It is seen in beriberi and hyperthyroidism, and it is also seen in pregnancy.
thank you and thank you for watching.